Hi, good evening. Uh, One of the most common questions that many of the new nurses or medical trainees coming to the NICU have is a concern about whether they'll be able to do the drug calculations correctly. It's quite challenging, especially because many of the drugs have to be prepared almost immediately. Some of the hospitals are lucky to have the pharmacy preparing it for them, but even then, in emergency situations, you have to prepare it by the bedside. The doctor has to prescribe it, and a good setup will have the right formulary to guide them prepare correctly. And the nurses have to check the prescription, they have to prepare the infusion, and they have to double check it before it's administered. So I'll be going through some tips on how to work out, especially when it comes to inotropes, morphine, prostaglandin, and so on. And we will also end this session by discussing how to calculate the glucose infusion rate, which is again one of the common questions that has been requested from me. If you have any questions, you can mention in the chat box, and hopefully we'll be able to answer that as we go on. So we have many types of infusions. We have the inotropes like dopamine, adrenaline, noradrenaline, milrinone, and recently I have been apologies, I think power needed plugging in. So we will restart. So we have many examples of infusions in the NICU. And one of the common units is either microgram per kilogram per minute, or units per hour, or microgram per kilogram per hour. And we have some medications like diuretics where it is milligram per kilogram per hour. So the inotropes, I have recently presented a few videos on the dosage, how it works, and so on. And vasopressin, as we discussed in the earlier video on shock, it's not commonly used, but it's better to be aware. It's in units per kilogram per hour. Actually, it's very small doses. In terms of sedation, they are usually in microgram per kilogram per hour and not in minutes. And prostaglandin, we will be discussing. It can be either nanogram or microgram, and it's better that your unit, the cardiologist and your team, discusses in the same terms, either use microgram or nanogram, but stick to the same one, don't go back and forth. And diuretics, thankfully we don't need them very often to be used as infusions, but it's in milligram per kilogram per hour. In terms of preparing the infusion, so we have to decide which medication to use and what dose range to use. For example, dopamine at 10 microgram per kilogram per minute infusion is the plan to start. Some medications like morphine or midazolam may need a loading dose at the start so that the effect is appropriate. We should determine the strength of the available formulation. This can vary from country to country. It depends on the manufacturer, so be careful to have your own units formulary where possible, but of course you don't need to be bogged down by that. The pharmacy can check that for you. As long as you don't prescribe in ml, you should be prescribing the dose in milligram of the drug to be used. So you mention the diluent that you want to use and the exact milligram of the drug you want to add in the diluent to make the proportion of infusion, but you don't prescribe the ml of dopamine, for example. So if the strength of the formulation is different, you would not be confused by that. So it's very important that you remember that, especially when you're moving jobs or moving from one unit to the other. So we should determine the concentration of medication you want in the infusion. So this is often guided by the formulary, and different formularies have different approaches, but most of them follow a similar principle. If you have a normal fluid intake, you may prepare a more dilute formulation, while if you want to restricted fluid intake, you should concentrate it as allowed. If the dose is higher, obviously the volume will go high if it's a diluted formulation, so better that you use a concentrated formulation. So an example is the use of single or double strength morphine. The same applies to insulin, for example, or many other medications. Where the dose goes high, you think about concentrating it so you don't waste your valuable fluid intake on the diluents used. So for dopamine, for example, usually it's at a strength of 1000 microgram per ml or 2400 microgram per ml, and most units settle with 2400 microgram per ml as a standard, unless you have a specific reason to use this. So the amount of drug to add will depend on the strength, as we discussed. So if you want 1000 microgram is 1 milligram, and if you're talking in terms of nanogram, 1000 nanogram is 1 microgram. So remember this as well. And for dopamine, 1000 microgram per ml, that is the strength I showed you here, 1000 microgram per ml or 2400. So 1000 microgram per ml would need 1 milligram of the drug for each ml of the solution you want to prepare. So you have to choose the diluent. Usually for dopamine, it's normal saline or 5 or 10% dextrose according to your preference. And if you want to prepare an infusion volume of 25 ml, we need to add 25 milligram of dopamine to make 25 ml. So when we say to make 25 ml, it's to have a total volume of 25 ml. So for the 2400 microgram per ml, we would need to add 2.4 milligram per ml. And if we are preparing 25 ml, 2.4 times 25 will be 60 milligram of the medication. So you can easily remember that when we prescribe dopamine infusion, the common used strength is 2400 microgram per ml, and you need to add 60 milligram. This is irrespective of the weight of the baby, so this kind of formulation is easier to use. And we would need to add the usual formulation of dopamine that we have is 400 milligram in 10 ml. That is the equivalent of 40 milligram in 1 ml. So to get 60 milligram, we need to add 1.5 ml of the medication, and we need 23.5 ml of the diluent like saline to make 25 ml of the infusion with a strength of 2400 microgram per ml. I hope this part is clear. So what is 1 ml per hour of the infusion equal in microgram per kilogram per minute? So this we have both ways of looking at it. We need to know whether the infusion rate, particular infusion rate, is at what dose, and the other way around. If you know the dose, you need to calculate how many ml per hour you need to give. So a simple way to approach this, you convert the total dose of the drug added to the syringe in microgram. In the example I gave you of 2400 microgram per ml, it's 60,000 microgram in 25 ml. You divide this 60,000 by the patient's weight. Assume we have a weight of 2 kilograms, it's 30,000. And divide this number by 60, which is the number of minutes in 1 hour. So you are getting it per minute. So 30,000 divided by 60, 500. And we have to divide 500 by the total volume in the syringe to get how much is in 1 ml. So the infusion rate of 1 ml per hour. So 500 divided by 25 is 20 microgram per kilogram per minute. So 1 ml per hour will give you 20 microgram per kilogram per minute. So we adjust the rate of infusion according to the dose you need. So if we need 5 microgram per kilogram per minute, it is 1/4 of the 20 microgram. So it will be 0.25 ml per hour infusion rate to reach that. If you need 10 microgram, it will be double of that, so 0.5 ml per hour. And if you need 20 microgram, it's 1 ml per hour. So this is how you calculate the rate of infusion once you know the strength of the solution. So going the other way around, how do I calculate the rate in mLs per hour to deliver X microgram per kilogram per minute? So you know the microgram dose that you want to give, and you want to know how many ml per hour. So suppose we want to give 5 microgram. You simply multiply that dose by the weight. So the weight assumed is 2, so 5 times 2 is 10. And then you multiply this number by 60 for 1 hour. So 10 times 60 is 600. And divide this number by the drug dose in the syringe. So we calculated 60,000 micrograms. So 600 divided by 60,000 is 0.01. And you have to multiply this by the total volume in the syringe, that is 25 ml. So 0.01 times 25 is 0.25 ml per hour. So this gives you the same as we got earlier. So for 5 microgram, it's 0.25 ml per hour. So it's basically reversing the same process. All you need to understand is that you need to know the total drug dose in the total volume, and then you get the ml per hour, and according to that you can calculate the dose that the patient needs to receive. Coming on to infusions that work on microgram per kilogram per minute or milligram per kilogram according to the medication that you use. And the example we'll discuss here is morphine infusion. The strength of morphine is normally 10 milligram in 1 ml, and the concentration that we use depends on the dose as well as the need for fluid restriction. So usually we use 100 microgram per ml in the concentrated forms, and that's the usual preferred because it gives you the flexibility of dropping or increasing the dose. The amount of drug that we need to prepare will depend on the volume. So most of the time we prepare 25 ml of the infusion. So if we make 10 ml, we will add 1 milligram of morphine. So because the strength we are aiming is 100 microgram per ml. So in terms of 10 ml, you need 1000 microgram, and that's why 1 milligram. The dose of the medication, because it's 10 milligram in 1 ml, we'll be adding 0.1 ml of the above drug to 9.9 ml of the diluent like saline or dextrose. And if we make 25 ml of the infusion, we can add 2.5 milligram to 24.75. So depending on the volume of infusion and the strength of the infusion, there is another strength of morphine at 40 to 50 microgram. So if you want to do the diluted version, you can do that as well. The usual rate of infusion of morphine is 5 to 20 microgram per kilogram per hour, and in post-operative patients the rate can go up to 40 microgram for better pain relief. A bolus dose of 50 to 100 microgram per kilogram is usually given at the start of the infusion, and if you have this infusion prepared, 0.5 to 1 ml of the above preparation, so I said 100 microgram per ml, so 0.5 to 1 ml per kilogram of the above preparation is given for this bolus. So it's quite easy to calculate the bolus as well. Similar to what we did with the dopamine, which is microgram per minute, here it is microgram per kilo per hour. So to calculate what 1 ml per hour of the infusion will equal in microgram per kilogram, so we have to convert the total dose of the drug added to the syringe in microgram. So 2.5 milligram was added to the 25 ml solution, so that will be 2500 microgram. We have to divide this by the patient's weight in kilograms. So with the 2 kilo baby, so 2500 by 2 is 1250 microgram again, and divide by the total volume in the syringe, that is 25 ml, so we get 50 as the answer. So 1 ml per hour will give 50 microgram per kilogram per hour of the infusion. So accordingly, if you want to give 25 microgram, it will be half of this. If you want to give a lower volume, so if the baby is getting 0.6 ml per hour, 50 times 0.6 will be 30 microgram. So we have to get the actual rate by multiplying it with 50. And the reverse way, as we calculated, how do we decide to give X microgram per kilogram? So for example, we want to give 20 microgram in a 2 kilo baby. So you multiply the specified dose by the weight and divide this by the drug in the syringe in microgram. So divide by 2500 in this case, and then divide by the volume again, and this will give you the rate in ml per hour that you need for giving this 20 microgram dose. So I hope this part is clear. This is similar for any medication infusion that you use, so you have to understand the principle and then you can practice it as you go on. Just to close this, we will discuss a very important infusion that is used in management of congenital heart disease, which is alprostadil or prostaglandin E1. As I told you before, the way we name it can be nanogram per kilogram per minute or microgram per kilogram per minute, but we should try to stick within the unit to standardize and use one. In our unit we are using microgram per kilogram per minute, even though it comes in decimals and small numbers, because the cardiologist prefers to use it that way. So the range is 0.005 microgram or 5 nanograms to 0.1 microgram to 100 nanogram per kilogram per minute. It's a wide dose range. We usually start with 10 nanogram, which is the same as 0.01 microgram, up to 20 nanogram dose. The diluent can be dextrose or normal saline. The concentration used is usually 10 microgram per ml, which is preferred. We can also use 5 microgram per ml if the dose is very low, so it's easier to use on the pump. The ampule contains 500 microgram per ml of the prostaglandin E1. So for 10 microgram per ml strength, and we need to prepare 25 ml of the infusion, you just multiply 10 by 25, which is 250 microgram. So this strength of this is 500, so we need 250. 0.5 ml of the above solution is added to 24.5 ml of the saline diluent or any diluent you use. For our example, we use a 3 kilo baby needing 0.02 microgram per kilogram per minute. So we have to multiply the specified dose by the patient's weight, as we did earlier with the morphine infusion. So 0.02 times 3.06. Multiply this by 60 to get the hourly dose. So 0.06 times 60, 3.6. And you have to divide this by the drug dose in the syringe, which is in microgram. So 3.6 divided by 250, 0.014. And you have to multiply this by the total volume in the syringe, which is 0.014 times 25. 0.35 ml per hour to infuse to get 0.02 microgram per kilogram per minute. So you can go over this again, the recording will be available, and just to understand and practice, you can use different doses or infusion rates that you want to use. So with this I'll close this section on drug dosing. The other important topic that we will discuss quickly is calculation of the glucose infusion rate and some tips around that topic as well. So glucose infusion rate is a infusion of glucose in milligram per kilogram per minute, and it can be calculated in babies on IV fluids and those on feeds or a mixture of both. The normal GIR is 4 to 6 milligram per kilogram per minute. This calculation is very important in babies with hypoglycemia, especially persistent hypoglycemia or those babies who are on TPN. The percent of dextrose indicates the gram of glucose in 100 ml of the solution. So if you say 10% dextrose has 10 grams or 10,000 milligram in 100 ml, and if you say 25% dextrose, it has 25 grams or 25,000 milligram in 100 ml. In terms of feeding, for term formula and breast milk, it's usually 7.1 grams, which is equivalent to 7% dextrose, and for preterm formula it's around 8.5 grams per 100 ml. So you have to remember this if you want to calculate the GIR for feeds. We have a couple of formulas which we commonly use, and the principle is the same. So you have to know the percentage of dextrose that you are infusing and the rate in ml per hour divided by the weight at times 6. So this is a very simple formula, but you need to get the infusion rate. You know the ml per kilo per day, and you have to divide that, you have to multiply that by the weight and then divide it by 24 to get the hourly rate. For example, if 10% dextrose is infused at 60 ml per kilo per day for a 3 kilo baby, the hourly infusion rate will be weight times ml per kilo, so 3 times 60 and then divided by 24, which will be 7.5 ml per hour. But once you have this infusion, you just have to multiply the dextrose strength, in this case 10%, times 7.5 ml per hour divided by the weight of 3 kilo times 6. So 75 divided by 18 is 4.16 milligram per kilogram per minute. If you use 15% dextrose, for example, 15 times 7.5 by 18 will be 6.1 milligrams per kilograms per minute. So it's fairly simple, and this is how the formula is derived. You have the IV rate and the dextrose, which is grams per deciliter, the percentage of dextrose, so 10 grams per deciliter times 1000 to convert the grams to milligram, and then you have to divide by the weight times 60, which is the minutes per hour, and 100 because you're using deciliter here and you want ml in the conversion, so you are using 100. So the zeros cancel out, and that's why you get dextrose percentage times infusion rate divided by the weight times 6. So you can remember this. The second formula is easier as well, and mainly because we use the ml per kilo per day and you don't need to convert it to ml per hour. So once you know that ml per kilo per day and the strength of dextrose, you just divide that by 144. So 144 is nothing but the number of minutes in a day. 60 times 24 is 1440, and the 0 in the 10 gets cancelled out by the conversion. So we have 60 ml per kilo per day, and you're using 10% dextrose. Divide that by 144, it will be 4.16. So we get the exact same answer as we got earlier, and obviously if you use 15% dextrose, you get 6.25 milligram per kilogram per minute. So you can use whichever formula suits you. If you're calculating TPN, for example, you would be already having the infusion rate calculated, so it's easier for you to use the weight times 6 formula. The dextrose infusion rate can also be calculated if you have the glucose infusion rate. So glucose infusion rate times 6 divided by the percentage of dextrose. It's just the reverse of the formula we use. So you can calculate any of these components by crisscrossing the formula. If the desired GAR is 5 and you multiply 5 by 6 divided by the percentage of dextrose, if you're using 10% dextrose, then 3 ml per hour of 10% dextrose will give you a GAR of 5. And if you're calculating this for milk, for example, because I said 7.1%, so we would need 5 times 6 divided by 7.1, so 4.2 ml of milk compared to 3 ml of dextrose. So if a baby is hypoglycemic, for example, and you want to give 4 milligram per kilogram or 5 milligram per kilogram, you really need 4 ml per hour of milk, which is quite a big volume when the mother is just starting to establish lactation. And that's the reason that if the baby is hypoglycemic, we may need additional supplement on the first day or two to correct the hypoglycemia, and we need to encourage the establishment of breastfeeding during that process. So we can also calculate the dextrose concentration we need to achieve a certain glucose infusion rate in the TPN. So the desired glucose infusion rate times 60 times weight divided by the hourly parenteral nutrition rate. For example, if we need glucose infusion rate of 8 milligram per kilogram per minute in the TPN with hourly rate of 12 ml per hour in a 2 kilo baby, so 8, which is a GAR, times 60 for the number of minutes times the weight of 2 divided by the infusion rate of 12. So we get 80 grams per liter or 8% dextrose to be used in the TPN formulation. So you also have glucose infusion rate calculators on many websites and apps, and I mean most of them use any of these units. So you need the infusion rate, the GAR or the percentage dextrose, and the percentage of dextrose and the GAR you are calculating. So when you're on partial IV and partial feeds, it's not that difficult. Remember that if a baby is on 50 ml per kilo of dextrose 10% and 50 ml per kilo of EBM, 50 ml per kilo per day is approximately 2 ml per kilo per hour, and the milk has 7 grams per deciliter approximately, and dextrose has 10 grams. So to calculate it, you just do the proportionate calculation. So 7 times 2 ml per hour plus 10 times 2 ml per hour. If you're using say 70 of dextrose and 30 of feeds, you would change this accordingly. The ml per hour you have to calculate for those individually and use that in this formula, divided by 6 using the same formula as before. So here it is 14 plus 20 by 6, which is around 5.5 milligrams per kilograms per minute. And we can also, if a baby has hypoglycemia, you may need to calculate a certain dextrose concentration. If the pharmacy is preparing, well and good, you just need to tell them I want to prepare 15% dextrose and they will send it to you. However, if you are going to formulate it in NICU, you can use this formula. So you have to use 5% and 25% dextrose for this particular calculation, but there are different options if you want to use different strengths of dextrose, like 50% dextrose. So you can use 10 and 50, 10 and 25 and so on. So this is same principle can be used for them. So 5x minus 25 equal to y. X is the desired dextrose percentage that we want to prepare, and y is the volume of 25% dextrose that you need to mix with the 5% dextrose to make 100 ml of the new dextrose strength. So let's assume we need 15% dextrose. So 5 times 15 minus 25, that's 50 ml. So basically we need 50 ml of 25% dextrose to be added to 50 ml of 5% dextrose to make the 15% dextrose solution. So there is also a simple tip to increase the glucose infusion rate by 1 milligram per kilogram per minute. If you can add 25% dextrose to that fluid in 2 ml per kilogram dose to the 8-hour infusion volume. If your unit is taking 24-hour volume, you have to adjust proportionately. So the 1 ml of 25% dextrose has 250 milligram and 2 ml will give you 500 milligram. And because there are 480 minutes in 8 hours, if you calculate 500 milligram divided by 480, roughly it increases by 1 milligram per kilogram. So remember that here we are multiplying by kilogram, so 2 ml per kilogram. So it will increase by 1 milligram per kilogram per minute. So these are some simple tips on how to calculate in the NICU. And since there are no questions right now, I'll stop this. Thank you for watching. The recording will be available.